Hey everyone, welcome back for another deep dive. And today we're going to be talking about something that I think is really important to all of us, and that is the future of U.S. healthcare.
Yeah.
And specifically, you sent over a couple of really in-depth reports that we're going to take a look at,
Yes.
both titled "Strategies for Improving U.S. Healthcare Outcomes and Managing Costs Through Digital Innovation 2025." And one is Part one focuses on clinical workflows, and then part two focuses on digital innovations themselves.
Right.
So,
Wait.
yeah, there's a lot to unpack here.
Thank
Luckily,
you.
we have an expert here to help us break it all down and pull out the juiciest, the most important insights for our listeners.
Absolutely. It's a dense topic, but I think, incredibly relevant as we're really kind of on the cusp of some major shifts in how healthcare is delivered and experienced.
Yeah, and it feels like it's, everyone's talking about AI and digital health these days, but these reports really lay out a concrete roadmap for how we can move beyond the hype and actually, make healthcare better.
Yeah.
Before we get too deep into solutions, though, maybe let's just take a step back and set the stage a little bit.
Sure.
The U.S. healthcare system, it's kind of a paradox, isn't it?
Absolutely. I think the reports highlight this right at the beginning. We spend a massive amount of money on healthcare, over $4.3 trillion annually, which represents 18.3% of our GDP in 2021.
Wow.
Yet we lag behind other developed countries when it comes to our actual health outcomes, so it's this classic case of more money, more problems.
Yeah, it's like paying for a five-star hotel and ending up in a dingy motel room.
Yeah, exactly.
The reports argue that digital innovation is key to breaking out of this paradox,
Right.
but it has to be done strategically, right?
Yeah, it's not just about throwing technology at the problem.
Yeah.
It's about really using it in a targeted way to address the systemic issues that are driving up costs and hindering quality care.
Yeah.
And, the reports make a strong case for coupling, digital advancements with strategic reforms to really move the needle.
So it's kind of a two-pronged approach.
Yes.
Smarter technology, smarter policies working together.
Exactly.
Okay, well, let's dive into some specifics here. The first part of the report focuses on transforming clinical workflows.
Right.
What are some of the key takeaways there for you?
Well, one area that really stood out to me was this emphasis on social determinants of health, or SDOH.
Okay.
This is the idea that factors like socioeconomic status, access to transportation, even neighborhood safety can have a huge impact on someone's health.
Yeah, it's really sort of acknowledging that health isn't just about, genes and personal choices.
Right.
It's really, deeply intertwined with the environment that we live in.
Exactly. And the reports, suggest that using SDOH data to segment patient populations can help tailor interventions and allocate resources more effectively. So, imagine, for example, being able to identify patients who are at high risk for hospital readmission due to factors like food insecurity or lack of transportation. By addressing those underlying social needs, you could potentially prevent those readmissions and improve their overall health.
That makes a lot of sense.
Yeah.
It's really about taking a more holistic view of the patient.
Mm-hmm.
Seeing them as a whole person within their community,
Mm-hmm.
not just a collection of symptoms.
Absolutely.
So another important clinical intervention that was highlighted is this idea of strategic use of annual wellness visits, or AWVs.
Yes.
Can you talk about that a little bit?
Sure. So, these visits are covered by Medicare,
Okay.
and they really offer a great opportunity to focus on preventative care and catch potential problems early on.
Yeah, it's like taking your car in for regular maintenance instead of waiting for it to break down on the side of the road.
Precisely. And the report also stresses the importance of robust transitions of care, particularly when patients are discharged from the hospital. Poorly managed transitions can lead to readmissions and unnecessary complications.
So it's about making sure that patients don't fall through the cracks as they move between different care settings.
Exactly. And digital tools can play a big role in streamlining these transitions, ensuring clear communication between providers and empowering patients to actively manage their own care.
Okay, so we're seeing a theme here: proactive, personalized, and connected.
Yes.
These reports are essentially making the case for a much more patient-centered approach to care.
Absolutely. And I think another key piece of that is integrating physical and mental health services. For too long, we've treated these as separate silos, despite the fact that they're deeply intertwined.
Oh, I completely agree. Trying to treat one without addressing the other is like trying to bake a cake without flour. It's just not going to work.
Exactly. And, these reports suggest that digital tools such as telepsychiatry and online therapy platforms can play a crucial role in making mental health services more accessible and integrated into primary care.
That's really exciting because access to mental health care is, a huge issue for so many people.
Right.
And then there's this whole shift towards value-based care.
Yes.
I know we hear that phrase a lot, but what does it actually look like in practice?
So essentially, it means moving away from a fee-for-service model where providers are paid for every test procedure or visit to a model where they're rewarded for keeping patients healthy and achieving positive outcomes.
Okay, so it's about incentivizing quality over quantity.
Exactly. And the reports highlight accountable care organizations, or ACOs, as a promising example of this in action.
Okay.
ACOs are groups of doctors, hospitals, and other healthcare providers who come together to provide coordinated care to a specific population of patients. They're held accountable for the quality and cost of the care they deliver, and they share in any savings that they achieve.
That sounds like a pretty radical shift from the way things are typically done in healthcare.
It is a major shift, but one that's gaining momentum, and digital tools are essential to making these value-based care models work.
Okay.
They can help ACOs track patient outcomes, identify areas for improvement, and facilitate seamless communication between providers.
So it's like giving healthcare providers a high-tech toolkit to help them deliver better care more efficiently.
That's a great way to put it.
Awesome. Well, that brings us to part 2 of these reports, which dives into the specific digital innovations that are driving this transformation.
Yeah.
And that's where it gets really interesting. We're talking AI, remote patient monitoring, all sorts of really futuristic stuff.
It is exciting stuff, but, it's important to remember that technology is just a means to an end. The real goal is to improve the lives of patients and create a healthcare system that's more equitable, accessible, and sustainable.
Well said. Well, I think this has been a really good overview of the first part of the reports. And I want to give our listeners a moment to kind of reflect on what we've talked about so far. What's resonating with you? What questions are popping up in your mind?
Yeah.
We'll be back in a flash to explore this exciting world of digital tools and how they're being used to really transform the way we deliver and experience healthcare.
Sounds good. So welcome back. I think we're all eager to delve a little bit deeper into these digital tools that are really reshaping the healthcare landscape. And as we touched upon, it's not just about the technology itself, but it's really about how it empowers both patients and providers.
Yeah, and the reports do a great job of outlining how these tools can be implemented strategically, to support the clinical workflow transformations that we talked about earlier. So, for example, we talked about the importance of managing transitions of care.
Right.
Are there specific digital tools that can help with that?
Definitely one area that's really showing a lot of promise is remote patient monitoring, or RPM.
Okay.
And this involves using wearable devices and other connected technologies to track patient data like vital signs, medication, adherence, even activity levels. And this data can be transmitted to healthcare providers in real time, allowing them to monitor patients remotely and intervene early if necessary.
So instead of waiting for a patient to schedule an appointment or end up back in the hospital,
Right.
doctors can proactively manage their care based on, this real-time data.
Exactly.
That's pretty incredible.
It is, and this type of remote monitoring can be particularly beneficial for patients with chronic conditions like diabetes, heart failure, or COPD. By keeping a close eye on their data, healthcare providers can help prevent complications and hospitalizations, leading to better outcomes and lower costs.
That makes sense. It's like having a virtual safety net for patients.
Yeah.
Helping them stay healthy and avoid those costly trips to the ER.
Mm-hmm.
But what about the patients themselves? Are there digital tools that are aimed at, making their lives easier and more engaged in their own health?
Absolutely. One area that's seeing a lot of innovation is the patient portal. These are secure online platforms that allow patients to access their medical records, schedule appointments, communicate with their providers, and even refill prescriptions.
So it's like having a one-stop shop for managing your healthcare needs online.
Exactly. And some portals are going even further, offering features like personalized health education, symptom trackers, and even virtual support groups.
Wow, that's amazing.
Yeah.
It really empowers patients to take ownership of their health and be, more informed participants in their care.
Mm-hmm.
The report also mentioned telehealth. How is that evolving beyond just, video calls with your doctor.
Yeah, telehealth has really exploded in recent years, and it's continuing to evolve beyond those simple virtual visits.
Okay.
So we're now seeing the emergence of remote monitoring platforms that integrate with telehealth, allowing doctors to conduct virtual checkups while also reviewing real-time patient data from wearable devices.
That's a game changer.
Yeah.
It's like combining the convenience of telehealth with the insights of in-person care.
Precisely. And we're also seeing the rise of asynchronous telehealth, where patients can submit questions or concerns electronically and receive responses from their providers at a later time.
That's great for those quick questions that don't necessarily require a full-blown appointment.
Right.
It seems like we're moving towards a world where healthcare is more accessible, more convenient, and less disruptive to our daily lives.
That's the vision, and digital tools are playing a huge role in making it a reality. But as we embrace these innovations, it's important to ensure that they're implemented thoughtfully and ethically.
That's a good point. Technology is a powerful tool, but it needs to be used responsibly,
Yeah.
especially when it comes to sensitive health information.
Absolutely. That's why these reports emphasize the need for robust data security and privacy protocols,
Right.
as well as clear guidelines for the ethical use of AI and other emerging technologies.
Speaking of AI, that seems to be, the hottest topic in healthcare right now. Everyone's talking about how it's going to revolutionize everything. What are some of the most promising applications of AI in healthcare, according to these reports?
Well, AI is being applied across a wide range of healthcare areas, from diagnostics to drug development to personalized medicine.
Wow.
One area that's particularly exciting is the use of AI for image analysis.
Okay.
Algorithms are now being trained to analyze medical images like X-rays, CT scans, and MRIs, helping radiologists detect subtle abnormalities that might be missed by the human eye.
So it's like having a second set of superpowered eyes to help make diagnoses more accurate.
That's a great way to put it, and this can be especially important for early cancer detection,
Right.
where finding those tiny abnormalities can make a huge difference in treatment outcomes.
Wow, that's incredible. And beyond image analysis, how else is AI being used to improve clinical decision-making?
Well, AI is also being used to develop predictive models that can help identify patients who are at high risk for certain conditions or complications. For example, researchers are developing algorithms that can analyze patient data to predict the likelihood of hospital readmission sepsis or even heart attacks.
That's amazing. It seems like AI has the potential to transform healthcare from a reactive system to a proactive one,
Right.
where we're able to prevent problems before they even arise.
Exactly. And this is where it gets really interesting. We're starting to see the emergence of AI-powered clinical decision support tools that can integrate with electronic health records
Okay.
and provide real-time guidance to clinicians at the point of care.
So instead of relying solely on their own knowledge and experience, doctors can access AI-powered insights to help them make the best decisions for their patients.
Precisely. These tools can analyze vast amounts of data, including the latest research findings and clinical guidelines, to provide personalized recommendations for diagnosis, treatment, and even medication management.
That's incredible. It sounds like AI has the potential to not only improve the accuracy of diagnoses and treatments, but also to enhance the efficiency and effectiveness of healthcare delivery as a whole.
Absolutely. And this is where the role of companies like Mesh Digital LLC becomes crucial.
Yep.
They specialize in helping healthcare organizations navigate this complex landscape of digital innovation, providing the expertise and guidance needed to implement these technologies successfully.
That makes sense. It's one thing to have all these amazing tools available,
Right.
but it's another thing entirely to integrate them seamlessly into existing workflows and ensure that they're being used effectively to improve patient care.
Right.
What specifically does Mesh Digital LLC bring to the table?
Well, they have a deep understanding of the healthcare industry as well as a strong track record in digital transformation.
Yeah.
They can help organizations assess their needs, develop a digital strategy, select the right technologies, and implement them in a way that aligns with their overall goals and values.
So they're like the architects of digital healthcare transformation, helping organizations build the healthcare system of the future.
That's a great analogy. They can provide the blueprint, the guidance, and the support needed to make this vision a reality.
This is all incredibly exciting. But I have to imagine there are also challenges to implementing these digital innovations in such a complex system like healthcare.
You're absolutely right. There are definitely challenges. One of the biggest is data interoperability.
Okay.
Healthcare data is often siloed in different systems that don't talk to each other, which makes it difficult to get a complete picture of a patient's health history and to leverage AI and other data-driven tools effectively.
It's like trying to put together a puzzle where all the pieces are scattered across different boxes.
Right.
You can't see the full picture,
Exactly.
which makes it hard to solve the problem.
And then there's the issue of cybersecurity.
Right.
As we digitize more healthcare data, we need to ensure that it's protected from breaches and hacks.
That's crucial.
Yeah.
We're talking about incredibly sensitive information here.
Yes.
And it needs to be handled with the utmost care and security.
Absolutely. And there's also the human element to consider. We need to ensure that clinicians are adequately trained on these new technologies and that patients are comfortable using them.
It's about making sure that technology enhances the human connection in healthcare, not replaces it.
Exactly.
Yeah.
It's about finding that sweet spot where technology empowers both patients and providers to deliver and receive the best possible care.
Well, this has been a fascinating deep dive into the world of digital healthcare innovation.
Yeah.
Before we wrap things up, let's take a moment to consider what we've learned and how it might impact the future of healthcare.
Okay.
What are some of the key takeaways that stand out to you?
I think the biggest takeaway is that digital innovation has the potential to transform healthcare in profound ways. We're already seeing incredible advancements in areas like remote monitoring, telehealth, and AI-powered decision support. And these innovations are only going to accelerate in the years to come.
It's an exciting time to be in healthcare, that's for sure.
It is, and it's important to remember that this transformation is about more than just technology. It's about creating a healthcare system that is more patient-centered, more equitable, and more sustainable.
Well said. I think we've given our listeners a lot to think about. So welcome back, everybody. Hope you had a few minutes there to just kind of process everything that we talked about in terms of digital healthcare advancements.
Yeah.
It's a lot to take in, but it paints a pretty exciting picture of what healthcare could look like
Absolutely.
in the future.
It does.
We started this deep dive by acknowledging, kind of the shortcomings of the current U.S. healthcare system, high costs, fragmented care, and often disappointing outcomes. But, what's so encouraging about these reports is they offer a path forward.
Right.
They offer a way to leverage digital innovation to actually create a healthcare system that's more efficient, more effective, and truly patient-centered.
Yeah, absolutely. And it's not just about improving the quality of care. It's also about making healthcare more accessible and equitable for everyone. We talked about how, social determinants of health play a huge role in a person's overall well-being.
Right.
And digital tools can actually help us address those disparities by connecting people with the resources and support they need.
Yeah, that's such an important point. Technology really has the potential to kind of level the playing field and ensure that everyone has access to quality care, regardless of, their zip code or socioeconomic status.
Exactly. And, and let's not forget the potential cost savings as well.
Right.
By shifting to a value-based care model and leveraging digital tools to streamline workflows, prevent unnecessary hospitalizations, manage chronic conditions more effectively,
Right.
we can potentially bend that cost curve and make healthcare more affordable for everyone.
Yeah, it sounds like a win-win situation for both patients and providers.
Yeah.
But as you mentioned earlier, implementing these changes successfully requires, really careful planning and execution.
Absolutely.
And that's where companies like Mesh Digital LLC come in.
Absolutely. Mesh Digital LLC has the expertise and experience to guide healthcare organizations through this complex digital transformation. They can help organizations assess their needs, develop a comprehensive strategy,
Right.
select the right technologies, and implement them in a way that aligns with their unique goals and challenges.
So it's like having a trusted partner
Yeah.
to help you navigate, these uncharted waters of digital healthcare. They bring the knowledge, the tools, and the support system to make that transition a success.
Precisely. And they understand that technology is just one piece of the puzzle.
Right.
It's about using technology to empower both patients and providers, enhance communication and coordination, and ultimately improve the health and well-being of individuals and communities.
So it's a very holistic approach, combining the power of technology with the human touch that's so essential to healthcare.
Exactly. And it's an approach that has the potential to transform healthcare from a system that's often reactive and fragmented to one that's proactive, personalized, and truly patient-centered.
Well, I think you've given our listeners a lot to think about today.
Yeah.
We've covered a lot of ground in this deep dive, but the key takeaway is that the future of healthcare is bright.
It is.
and it's being shaped by the choices we make today.
I agree. We have this incredible opportunity to leverage digital innovation to create a healthcare system that's more equitable, more accessible, more effective, and ultimately more human.
That's a future worth striving for. So for our listeners out there who are eager to learn more about this exciting world of digital healthcare transformation, we encourage you to check out the full reports that we've discussed today. We'll
Yes.
be sure to include links in the show notes, and if you're ready to kind of embark on your own digital healthcare journey,
Mm-hmm.
Mesh Digital LLC is a great resource to connect with. They have the expertise and the passion to help you navigate this complex landscape and achieve your goals.
Definitely a valuable partner to have in your corner.
Well, that's a wrap for this deep dive. We hope you surfaced with a newfound understanding of how digital innovation is poised to revolutionize the world of healthcare. Until next time, stay curious, stay informed, and stay well.